and welcome back to Political Debrief. I'm your host, Josh Oliverio. Today, I want to talk about the Canadian Dental Care Plan, which you might have heard in the news recently as the government announced the rollout and eligibility criteria for the benefit. As I'm sure you can imagine, there are a lot of tiny details and nuances to how this plan works. So, I am joined by Marika Nadeau, the Director General of Engagement and FPT Relations in the Oral Healthcare Branch at Health Canada, to talk about the program and how young people can take advantage of it. Hope you enjoy our conversation now. And Marika Nadeau joins me now. Thanks so much for taking the time.
Thank you. Thank you for inviting me, Joshua.
So first of all, just kind of give us a general understanding. What is the Canadian Dental Care Plan?
So good questions. The Canadian Dental Care Plan aims to help ease financial barriers to those Canadian residents that do not have access to dental insurance. So we know that the oral health care is a key part of our overall health, but getting to see an oral health professional can be expensive. And we also know that a third of Canadians currently do not have access to dental insurance, and 1 out of 4 Canadians do not go see an oral health professional due to costs. So the Canadian Dental Care Plan, the budget in 2022 and 2023 committed significant investment of $13 billion over 5 years, starting this fiscal 2023-2024, and $4.4 billion ongoing for the Government of Canada to implement the Canadian Dental Care Plan. So what it will do is provide dental coverage for Canadian residents who currently do not have any means to access dental insurance.
What makes dental health so important that it's a big priority? What's so important about dental health?
Well, there's bad oral health can have great complications to your overall health, like cancer, stroke, diabetes complications. For pregnant women, it could be giving birth sooner and greater mortality of all causes, to be honest, because there's a lot of bacteries that can be created in your mouth that then transmits in your overall body, which could have that could be disastrous. So having a good oral health is definitely plays an important role in the overall health.
And there's currently a dental program in place right now called the Canadian Dental Care Benefit, I'm pretty sure. Can you help us understand the differences between this program and the current program that's been rolled out?
So the Canada Dental Benefit was rolled out in last December 2023, and it aims to, again, ease financial barriers for children under 12 as a start. So when the federal government put in place oral health coverage in 2022, this was an interim benefit that was made available to families so that they could get a direct payment, so up to $650 per eligible child per year. So there was 2 benefit periods, one that started for services covered starting in October 2022 to June 30th, 2023, and then the second benefit period, which started in July 2023, will be available to June 2024. So it's a direct payment, so parents can use that money to offset any out-of-pocket costs for oral health services. The Canadian Dental Care Plan will be a coverage plan. So when you go to see an oral health provider, the provider will submit the claim directly to Sun Life, which is our service contracted provider. So similar to how you reimburse through a private insurance, but it will be through the federal government. So instead of being a one-time payment like the benefit, the Canadian Dental Care Plan will be your provider bills directly the Canadian Dental Care Plan for the services that are covered by the plan at the established fees. So it's not important to nuance that this is not a free dental program, because there could be still out-of-pocket costs for patients when going to seeing the oral health provider, but definitely will provide reimbursement for services covered under the plan.
In terms of eligibility, is the eligibility similar to the Canadian Dental Benefit?
Yes, similar. So for the Canadian Dental Care Plan, there is 4 eligibility criteria. So it is an income tested program like the Canada Dental Benefit for the children under 12. So you need to have a family adjusted net income of less than 90,000. So your your parent, your parent and their wife or a common law partner, if applicable, will need to have an income of less than 90,000, not have access to dental insurance, need to file their taxes so that we can assess the family adjusted net income, and be a Canadian resident for tax purposes.
In terms of helping Canadians, how does this program help younger Canadians, maybe 0 to 25? How does this program help younger Canadians?
So we know that out of the 9 million eligible Canadians, that about 900,000 children under 18 will be able to benefit from the Canadian Dental Care Plan that would not have the means through private insurance by their parent. So hence why we're starting with seniors and persons with disabilities and children. So again, it's 10% of the eligible population will be under 18, will be able to be eligible for the plan. I don't have the specifics between 18 to 25, but children under 18 is approximately 900,000.
And in terms of the actual dental care that's being provided, what types of dental procedures or medical appointments, etc., are covered by this plan? Is it everything? Are there specific basic dental services? What's covered?
Important to note that there will not be an annual spending limit like we normally see in private insurance. So, but there will be a wide range of oral health care services that will be offered, with some that have frequency limits. So as an example, you could preventative services, you could have scaling, like cleaning, where you could have you will have a maximum number of units that in the dental world that you call. So there will be frequency limit for the services, and I'll give you examples of what is covered under the Canadian Dental Care Plan. But also considering the needs of the different population, if it's based on clinical criteria, if, for example, those covered under the plan would require major restorative services or services that are above the frequency limit, then there could be a request for prior approval. So the oral health provider would submit additional information on why the patient would need more units of scaling, for example, due to clinical criteria from a medical perspective, and they would be granted. So that's a key point, that there's no there's no maximum spending, but there are limits. And some of the services covered, general example are preventive services, like I was saying, scaling, or commonly used known as cleaning, polishing, sealant, fluoride, diagnostic services like examination and x-rays, restorative services like filling, root canal treatments, complete and partial removable dentures, maybe not necessarily used for young adults, but periodontal services like deep scaling, as well as extractions, for example.
And sorry, really quick, just a clarification. When the doctor, or I guess the dentist, would submit a request for an exception, we'll say, to the limits on services, who makes that decision? Is it Sun Life or is it the Government of Canada?
It depends. In most cases, it will be Sun Life on behalf of the Government of Canada, based on the policies and guidelines and critical criteria that Health Canada will provide to Sun Life. But there will also be exceptional cases where potentially services are not currently covered in the basket of service, but for exceptional services, there is a procedure that is required by an individual, and those would be assessed by Health Canada.
In terms of rollout, when can people start getting access to this plan?
So right now, I was mentioning earlier, there's about an estimated 9 million Canadians that could potentially qualify for the Canadian Dental Care Plan. So we want to make sure that the implementation is phased in a way that is easy for Canadians to register, that there's not too much long wait times on call centers and things like that, and also for the oral health providers, so that they don't have 9 million Canadians eligible all at once to access services. So we are doing a phased implementation, starting with seniors. So as of this week, seniors 87 above will be receiving a personalized letter inviting them to enroll, and that will continue through January, February, and March until we reached all of the potential eligible seniors that are 70 years of age and older. And then in May, an online portal will be available so that seniors 65 and over can apply online. And then children under 18 and people with disability that have a valid disability tax credit will be able to apply online in June. And then all eligible remaining adults will be able to apply starting in 2025.
And I guess I want to kind of zoom out a little bit now. How does this program plan fit into the general picture of supports and benefits to support the healthcare of young Canadians?
Well, I guess if young Canadians meet the eligibility criteria, so either through their parents or as once they are 18 and young adults, if they meet the eligibility criteria, so important to file your taxes, and if they have a income of less than 90,000 and no access to dental insurance, then they would definitely be eligible to apply and should to get access to oral health care. We also know that young adults, as you've mentioned, Joshua, like either through new employment or new they're going into the workforce, but not necessarily have private insurance. So definitely something that would give them the continued coverage that potentially they would have had with their parents, but now as a young adult, that gives us that gives them a continued coverage. So that's why I would say in that regards, what are the benefits for them?
All right, my last question for you today. If there's one takeaway or one thing that people should know about this plan, what is it?
The objective is to ensure that as many Canadians as possible have access to oral health care, because oral health is so important. So my plea to young adults is that if they meet the eligibility criteria, they should continue to see an oral health provider, because your oral health is so important. So and as the sooner you have a good oral health, the better it is for your overall health.
All right, Marika Nadeau, thanks so much for taking the time for me today.
Thank you, Joshua. Have a nice day.
And that's it for this episode of Political Debrief. Thank you so much for watching. As always, I invite you to check out the blog post down below with some information about the program if you want to read more. I got some additional information from Health Canada about some specifics on the program and how many young people it's going to affect. So I invite you to check that out now. Also, I would invite you to follow me on all social media and check out the podcast edition down below. That's all for me for now. I'll see you again in 2024. Happy holidays.